All right, let's do this. This is all the equipment that you will need when you are performing a venipuncture. First, when you are performing your venipuncture, you will need your tourniquet. You'll need your needle, depending on, always remember, look at your veins versus the needle, right? So if I have small fragile veins, I'll be going for my 23 gauge needle. Or if it's just a beautiful healthy vein, we're gonna go for our 21 gauge. So we have our tourniquet ready, we have our needle, our hub put together, okay? Just like that. Make sure it's on there pretty snug so it doesn't pop off, okay? When you are attaching it to your butterfly, you remove this plastic, it comes off. And always remember, we are attaching the hub to the covering part of the needle, not to this side, not to the other side, but this side. So this is my straight needle with the plastic covering, with the rubber covering, and then there it is as well. So you'll take it, attach. Okay, that's for your butterfly. And then for my straight, this is how the straight needle comes, with this covering to cover the rubber part of the needle. And then this side is the actual needle, just like that. So you'll pull it off, apply your hub, just like that. This is my safety. Now, when you remove the cap, remember, we will never recap. But since I'm just showing you and teaching you, I'm going to recap, but don't ever do it. Don't ever do it. Here we go. I'm going to show you. Pull that off. This is what I mean, bevel up. You see that opening right here? You see the opening? That's the part that will be going inside of your patient. This opening, not this way, but this way. So whenever I say bevel up, this is what I mean. We have our needle. We have gauze. This is a 4x4, but you will usually use a 2x2. So here, this is what a 2x2. And you have your alcohol. So one more time. We have our tourniquet. We have our needle that I have attached my hub, my gauze, my alcohol, and whatever tube I'll be using. Okay? When you remove the cap, be careful. We inspect the needle. It's not rusted, looks good. Bevel up that opening. How you hold your needle. You take your index finger and the middle finger, which goes underneath. You take your thumb to place it on top of on the hub. Okay? So I'm going to show you this way. just like such. I have tucked in my ring finger and my pinky. It's out of my way, and this is how I hold it. Bevel up. There's that opening. Like this. My little flaps here, you will use those when you are inserting the tube, just like this. Let it stay. I take my other hand. Remember, the hand that is holding the needle will be your dominant. The dominant hand is the one that holds the needle. Non-dominant does everything else. Takes off the tourniquet, moves the tube, hovers with the gauze. So it's like that. I use my index and my middle finger. It's my thumb that is doing it. I'm not going to go like this. I'm going to use my thumb to move it in. So here we go. I put my middle finger and my index finger on my hub here. Still holding the needle. Thumb, index, middle. The pinky and the ring finger is closed out of the way. Here we go. This. And my thumb is at the bottom of the tube. Push. This hand does not move. To remove, here we go. Bevel up. We always hold our needle at a 15 to 30 degree angle. Apply your seal and discard into your sharps container. Okay? Watch this video over and over to know where to place your hand. Remember, your thumb goes on top of the hub. Then you have your index, your middle finger on the bottom. This hand, which is your non-dominant hand, will be doing the other work. Your tourniquet, your tubes, your gauze. And please be careful. Never recap a needle. And when you are done, discard it into a sharps container.